Pacing. When the R-series is used with the one-step pacing or one-step complete resuscitation electrodes, a separate ECG cable is not required. If these electrodes are not used, you must first attach an ECG cable to the device and place the 3-lead ECG electrodes on the patient. To begin pacing your patient, turn the dial to Pacer. The downward spikes indicate pacing pulses. The rate will default to 70 beats per minute unless your institution has configured it otherwise. For one-step pacing, the ECG signal appears in lead P3. It is important to note that while ECG signals acquired from P1, P2, or P3 are appropriate for ECG rhythm assessment and to determine electrical capture during pacing, they should not be used for diagnostic purposes. Use conventional ECG electrodes and a separate ECG cable for that purpose. To choose a lead with good visualization and proper sensing of the R wave, change the lead by pressing the lead button. Press the lead button to cycle through the leads P1, P2, and P3. When pacing with a separate ECG cable, the ECG signal appears in lead 2. Increase the output by turning the dial clockwise. The normal range for capture is between 40 and 80 milliamps. Usually, when obtaining capture, you will overshoot the patient's threshold and will need to turn down the output. If this happens, decrease the output slowly until you just lose capture. The minimum output that obtains capture is the patient's threshold. Once you have determined the pacing threshold, set output to 10% above that threshold. Confirm electrical capture by viewing a downward pacing spike, followed immediately by a widened QRS and an extended, sometimes enlarged T-wave, occurring at the selected pacing rate. The intrinsic rhythm should be absent. Mechanical capture can be confirmed by physically palpating a femoral or right radial brachial pulse. Avoid assessing the pulse in the carotid and left radial arteries because muscular contractions from the pacing pulse may cause misinterpretation. At any time during pacing, you can use the 4-to-1 button to determine the patient's underlying rhythm. Press and hold the 4-to-1 button. This suppresses 3 of 4 pacer impulses, which lets you visualize the underlying rhythm without losing capture.